Well, good afternoon, everybody. My name is Frances Vega Pietri, and I would like to welcome you to my presentation of supporting Hispanic families during COVID-19. And before we get started, I have two quick reminders. If you have questions, please post them in the chat box. Our moderators are gonna get them to me, and by the end of the session, we will answer them. And our second reminder is that there's going to be a survey at the end of this presentation, and also the link will be posted in the chat box. So I'm going to talk a little bit about me. Again, my name is Frances Vega Pietri, and I am born and raised Puerto Rican. And I am also a mom. I have two kids on the autism spectrum. And when my oldest, who was also born in Puerto Rico, was diagnosed with autism, uh, there was a lack of resources. And we decided to move to Michigan in 2006 to get some help for him. It was a challenging journey, especially because of the difference in culture. So that made me aware of how important it is to be cultural competent when you're providing services. So when things started running smoother for my son, I got involved with a lot of nonprofits in the area, in Kalamazoo area in Michigan, where we live. And I've been involved for 10 to 12 years with this, and currently I am working with Ask in Kalamazoo as family services. Uh, so it is very important for me, so people be aware that uh, those little details, just being aware of cultural differences, makes such a big difference in the outcomes for the families. So that's why I am very excited to share my experience with you guys. So without further ado, uh, let's get started on talking about Hispanics. So there's a lot of confusion between Hispanic and Latino, and some people use those terms like they are the same, but there are differences on it. Hispanic is based on language. So Hispanics, first of all, is not a race. It is an ethnic distinction. The Hispanics came from all races and traits. And Hispanic refers to countries that were on the Spanish domain, Mexico, Central America, some parts of South America, where Spanish is the primary language. Latino refers to the geographic location. So Latino definition includes Brazil. And Latinx, it's a newer one used for younger people. It's a gender neutral one, but most likely the young people is the ones that use this definition. But for this presentation, we're gonna use Hispanic. This is the one that they use in the census. So we're gonna be using this definition for the rest of the presentation. To review, the Hispanic groups are the people from the countries that were on the Spanish domain. And these are the groups: Argentine, Bolivian, Chilean, Colombian, Costa Rican, Cuban, Dominican, Ecuadorian, Guatemalan, Honduran, Mexican, Nicaraguan, Panamanian, Paraguayan, Peruvian, Puerto Ricans, Salvadoran, Spanish, Uruguayan, and Venezuelan. And here is the map view of the countries. And I also want to make aware that Puerto Rico is a US territory, and we are the only ones from the Hispanic group that we are American citizens. A lot of people are not aware of that, so I want to emphasize that from all this bunch, Puerto Ricans are US citizens. And Hispanics in America. I got some data from the Pew Research Center and from the census. And for the Pew Research Center, 17% of the nation's total population are Hispanics. According to the census, the number is 18.5. And 10 years ago, there was 50.7 million Hispanics in the USA. Right now, they estimate there is like 60.6% millions of Latinos in United States. To have a view of, there is a lot of countries that are part of this population. Each one has a rich culture, different backgrounds. So with these pictures, you see their flags and a little bit of sense of what that culture looks like. So something that is very important is that even all these countries have the same language. Each one have their rich own culture, values, and beliefs. And even the Spanish is different from country to country. A word that might be a compliment in one country, it might be an insult in another one. So you have to be aware that 18, 19 countries have a lot of differences. And if you assume all Hispanic cultures are the same, you're making a big mistake. One of the biggest groups of Hispanics in the USA are the Mexicans, but all of the other Hispanic cultures are very different. So it's something to be aware of. The highest, you got the Mexican is the biggest group. After that comes the Puerto Ricans, then the Central Americans, and then the other groups from other countries. So those are the three big groups of Hispanics right now in the USA. This is something very important because most likely in the media, when you think of Hispanic, you think of somebody of dark hair, dark skin, and that plays soccer, because that's the way the media always portray us. But in real life, a Hispanic can look like anybody else from the world. So we come from different ethnic backgrounds, different native Indians like the Aztecs, the Mayan, the Incan, people from the Caribbean, African American, European, all of them got into the mix. Even Asian groups, especially Peru, there was a time that they had a lot of immigrants from Asia, so people from Peru can look like somebody from Asia. So it is a very diverse population. And again, even that Spanish and some things in the culture are like each country has their own thing. So we cannot lump them together in just one group. So now I'm gonna talk a little bit of some of the details that Hispanic culture has in common. So let's get to it. The first one is a very important one. There is a strong belief in fate. It is what it is. It is God's will. What's going to happen is going to happen. And there is this attitude of resignation that you don't have control over what's going to happen. So you feel powerless because you are not going to achieve anything because it's supposed to happen that way. Because it is what it is. It's God's will. It's not going to change. Why do I have to look for services? But it's because it's so strong, this belief in faith. That's why sometimes it's difficult to convince them to get help. As a culture, they're very tolerant and they're very sympathetic towards others. The speech and hand gestures are one and the same. We are loud, we talk with our hands, we like touching and hugging and kissing. So, yeah, we're very lively. Another important piece is eating uh, accompanies all times of entertainment. If you have a meeting and you're going to have Hispanics, you have to provide food. That's something huge with our culture. And it's not just the appetizers, you have to bring real food. It is expectation for them. They acculturate, but they never assimilate. Hispanics, we are very proud of our culture, and we get assimilated to the culture here, but we're always gonna be teaching our children our traditions, our customs. Most of us speak Spanish at home and then we speak English outside. And we make sure our children remember the traditions, especially for Christmas. We have our own thing going on. So, yeah. Family is another very important piece in our culture. Family is everything. And family includes, just not the close knit group families, also the extended families, sons in law, mother in law, even the next door neighbor is part of the family. Uh, we are very strong believers in community. And when we say that it takes a village to raise a kid in the Hispanic culture, it really is. There is never an empty nest. Kids are not expected to move from home when they are 18. They can stay with their parents until they get married, or if they just separated from their partner and they want to just come home. It's not a big deal for Hispanic families. And we also don't lean towards sending our older relatives to group homes. So it's expected that we take care of our oldest too. So you're gonna see a lot of families that have the grandparents living with them too. So it is very common in the Hispanic culture to see that. And again, there is not an expectation when the kid go to college, it moves out. There's no rush with Hispanic families about that. We're very group oriented. Again, that community thing. And another thing is we are very relaxed about time. And that also brings some issues when we are living in the United States and you're expected to show up on time for your meetings. So that's something to keep in mind with the Hispanics. Our traditional family roles, Hispanic family is patriarchal, and the father has the final say in making decisions. And Most likely he's the sole provider and everything has to go under him, or like the firstborn son. And if grandpa is around, grandpa is the one that makes the decisions. So, but that's in the traditional family role, and times are changing. And for the Hispanic community, times are changing too. And living in the United States for so long, second, third generations, this is changing. The approach to decision making is more balanced, and women now are in the workforce and also getting to make decisions. So this is getting modernized. So in the modern Hispanic family, because of opportunity and sometimes because of need, females are now more participating more in the workforce. Uh, the Hispanics in United States, they are no longer holding the traditional view of machismo. If you're not familiar with the term machismo, it's like toxic masculinity, but on steroids. You know, these powerful men that get to do everything and everybody like worship them. So thankfully, this is changing. And most Hispanic women are working now outside the home, but the traditional role of being the nurturer and the caregiver falls on them. And the father mostly is the main disciplinarian. And a little bit about social media. WhatsApp is huge. It's huge on the Hispanic community. First of all, because in most of these countries, cell phones and internet are very pricey. It's not accessible for a lot of people. And this app lets them communicate and stay in touch with the family. So it's huge for them, especially for the older people that don't like to get in the regular, typical social media. But numbers show that Hispanic youth utilize social media more than the regular kids, especially Instagram and Facebook. So with the youth, they use both WhatsApp to keep in touch with the relatives in their hometowns and the countries, but they use the typical like any teenager and a little bit more than the typical teenager. So going back to families and parenting style of the Hispanic population, uh, they are very nurturing, they are very protective of their children, but they are also very strict. If you wake up every Saturday morning with your mother, with the very loud music and the smell of fabuloso, getting ready to do all the chores in your house, you grew up in a Hispanic family house. It is, Saturday is chore day and you need to do your chores. There are no excuses for that. And children and teenagers are expected to follow the rules, are expected to do their chores, and as they grow up, they might need to get a job and help the families. And another thing is that they are very private. Even they are very social. They're very private with the stuff that happens in their home. So they don't like when children are talking to outsiders about what's going on in the home. So they are taught to respect authority figures, but not to talk about what's going on in home. They're very private about that because there is something in the Hispanic culture that is called respeto. In English, is respect, and that is a highly important thing in our culture. If we just know each other, it just met me, You are not gonna tell me, you're not gonna be casual about it. You're not gonna call me on my first name basis. In English, and I'm gonna talk a little bit about this later, about the tú and usted. In English, you only have you, but in Spanish, we have some other words that explain those roles of, of respect. So, talking to authority figures is something that children are taught not to do. And that's a challenge when something's going on in school or we're getting services for them. And to exhibit emotional restraint, you don't show up your feelings, you suck it up. And that's the way we roll. And that's the way we were raised. We don't show our feelings to others because it shows our uh, vulnerability. Again, Hispanics have a very strong sense of community, and everybody in the family structure can discipline, even the neighbor. Even the neighbor can call you out and tell your parents you were doing something that you were not supposed to. And for caregiving, now that moms are working more out, the first choice is the grandparents or the aunts and uncles, the godparent or godmother, or the neighbor. Those are going to be the first choices. If there is no other choice, then we're going to talk about like a preschool or something like that. Uh, Parents are always very concerned about the children's happiness. And if there is an event where they cannot bring their children, they are not going to go. It is expected that for everywhere you go, you're going to bring your children. And that's why sometimes getting them to do stuff with other children or having that self-care time or me time or, oh, why you don't get a babysitter and go and have a date with your husband, it's tough for them. It's like you never think of leaving your children with somebody you don't know to go out on a date. It's something that is not common in our culture. Disabilities and mental health. Disabilities are kind of like a taboo subject. It is something very personal. And again, this belief that it's God's will. It is what it is. It is a part of life, and we deal with this. And they accepted it like that. And sometimes it's so hard to get them to reach those services because, they don't think there's going to be a better outcome. Another thing is a saying, a very, very typical saying that is, los trapos sucios se lavan en casa. In English, that will say airing dirty laundry. I think it will be the better way of saying it is that you don't talk about your personal things with strangers, especially something as private as mental health issues or disabilities issues, especially for the eldest in the house. That's like a big no-no. So sometimes that's a challenge when you're trying to get them to get treatment. Another thing is that we have a lot of made up, I will say, sickness. Eldest Hispanic people have something called de sereno, and that's something that when the night comes out, you have to have your children covered because if they get too cold, they're going to get sick. So they have a lot of diseases that are like that. And sometimes when somebody is depressed or have any other issues, they say, oh, he just have a headache or like, nerve attack or like stomach ache, and they dismiss it like that. And, it's like, it's not, it's just, the way it is. So that's why we have to make sure when we're working with one of these families, we have to involve all the members on everything, because if we want a better outcome, they have to be aware of everything that's going on, especially with mental health. It is so hard to get them to admit there is a mental health issue in the family, and that there is no other special sickness around. It is something that needs to be addressed. So yeah, that's a big challenge sometimes. So to get an idea of how many Hispanics get services for mental health, only 33% of them. And if you compare that to uh, the typical US average is 43%. So there's still a lot of people who are not receiving treatment for a lot of different reasons that we're going to talk a little bit later in the presentation. So this is something that we have to keep in mind. If you see that graphic, it will tell us that 18.3% of the population is Hispanic, and of those, only 16% get the services. And that is about 10 million people. So there is a lot of people that are still not receiving the services. Now, we're going to be talking about this pandemic and how this pandemic is impacting the Hispanic population. They're getting uh, hit harder than some of the other groups. So, in numbers, if you see, we have like 18.5% of the total population. Latinos or Hispanics make 31% of all of COVID cases as of August. 25% of all the children population in America are Latinos or Hispanic, and they're making 45% of all COVID-19 cases in kids. Those are the numbers until August, so now we know they are way up. To get a look to see how these disparities are showing up, I brought some numbers from 3 different states. So you see here that Utah is 14% Hispanic, but they make 32.6 of the COVID cases in September. Oregon is 13% Hispanic, but they make up 39% of the COVID cases. Washington is 13% Hispanic, but they make 42% of the COVID cases. And these were the numbers in September. So you could imagine how high these numbers are now. So why this is happening? And if you want to know a little bit more about why this is happening, you can check out the CDC report on health disparities of race and Hispanic origin. They have a lot of great data regarding this. So you can get to know a little bit more about this. What the numbers show us is that Hispanics are facing a really, really hard time with this pandemic. And one of the biggest reasons is because most of them are essential workers. And this is a population that already has a lot of inequities in income and healthcare access. food, poverty rates. There are a lot of things that are playing in this, but the most important piece is that the essential worker piece. As you see here, the Latinos or Hispanics make up 70.6% of the US workforce. And you see there in the graph that agricultural workers, food manufacturing, medical assistants, grocery store workers, transportation, pharmacy and drugstore workers. They have essential jobs. They don't get to stay home. They don't get to do the social distancing. So they are more vulnerable to this disease. And because of a lot of inequality in this population, the children have experienced food shortages 40% higher than the national average since the start of COVID 19, and these numbers were from July. So you can imagine now how that's looking like for these families. To summarize, eight big ways in how the pandemic is impacting the Hispanic population. First of all, for some reason, the rates are higher on them. They don't have access to the same healthcare, to the testing. They are essential workers. They don't get to work from home. They don't get to social distance. The inequalities in housing and access to services and all that, food insecurity, housing. They don't even have access to the same free spaces like parks and stuff like uh, most of the people do. They have like this whole standard family living in, a little apartment. So they don't get to do what most of the people can do to prevent the virus to affect them. So in this graph, in a nutshell, you can see why the impact is so high on them. And if you want to know and learn a little bit more about this, there is the link Salud Corona Equity, and we'll give you more details about this. This is the one that I was telling you about. They don't have access to open spaces and stuff because of the living conditions. Most of it's crowded in apartments and stuff. Another thing that I want to talk about is the barriers to accessing services. Why it's so hard to reach this population? Why it's so complicated? First of all, the language. You don't have that much Spanish speaker in your agency. That's going to be a challenge. Culture, that belief that in faith sometimes complicates the uh, community, the Hispanic community searching for services. Citizenship status, sometimes even they are legal or they have their citizenship, they know somebody who does not, so they don't want to put their friends or family uh, in peril. Uh, there is also limited and varied access to the technology. Right now in the pandemic, we're doing a lot of telehealth services, but some of these people don't even have a computer, don't even have internet, or don't even know, they don't even have an email address. It's very challenging for them to support their children in remote learning too. And the healthcare system and other social service agencies work very differently here in the United States that in different countries of Latin America. So that's also another challenge. So, like everything, all these factors, have an effect on the community mental health. Uh, the increased mental health distress because of social isolation. They are not getting to spend time with their family, with their church, with their community. The growing concerns. I'm an essential worker. I have grandma and grandpa living with me. I don't want to get them sick. I have young children at home, and we only have 2 rooms, and we have like 10 people in the house. How we're gonna do the self and the distancing and all that. The fear of losing your job, or you're having less hours because of all these complications with the pandemic, and you don't have that many options. And if you have a service, just telehealth is not something that you love to do because you prefer in person. So all of these things wear down your mental health. It's a very stressing time, and there's a lot of anxiety of all these things going on with the community right now. So I'm going to talk now about my recommendation for providers. So this one is one of the most important to me. Uh, Use the client preferred language. There are laws that require that all the services are provided in their language, and get a official translator or the paperwork in their language. So these laws cover nearly all healthcare and public education systems. So this is a must. And for that, you to be successful with that, you need to find a fully bilingual interpreter. Interpreting is hard, even if English provider go there with it. So, and again, the working with some of the words are going to change, and some of the meanings are going to change too. So even having somebody who's qualified and prepared is gonna be expect some challenges. There are a lot of cool apps right now on the internet to learn some basic Spanish. One of my favorite ones is the Duolingo, and you can learn some basics. Hispanics are gonna like if you go and, instead of good morning, good afternoon, you say buenos dias. They don't care if your pronunciation is funny or not. They will appreciate the effort. It is some nice touch. So what, even gracias will go, they will appreciate. So always learn those few little words that could make a difference. And if you're serving Hispanic population, you must have bilingual staff. So always have put your clients in touch with that person. If I'm not gonna be here today, you can contact so and so. You have questions, and keep those lines of communication open. It is very important. If you're gonna take something from this presentation, only one thing, this is the one thing. Please do not use children or youth as translators. This is something that all the years I've been involved in this, I see a lot. It should not happen. It still happens for a lot of reasons, but this is very important, and I want to explain you why. When you're asking a child to translate, it changes the family dynamic. You're doing a switch of power. You know, the parents don't speak English, the child does. You're making him be like the adult in the family, and you're throwing a responsibility on that child, and they are not prepared for that. Remember when a family is moving from another country and getting used to live in the United States, kids always get used to those changes faster. They get immersed in the culture, they learn the language real quick, and because they are in school, like they get used to things very fast. For the parents, it's challenging. Imagine if you right now have to learn another language out of nowhere. You have 1 month to learn Spanish. It's gonna be hard. So you cannot expect these parents with everything that they're going to, boom, learn the language. But putting the kid on charge is something we should never do. No one will expect a 5-year-old to understand some of this language, like we were talking about the interpreters, that they don't know the agency lingo or the medical lingo. You will not expect a child to know what is a CT scan, an MRI, an assessment, or you will never put him in a position to tell his mother, you know, you have end stage breast cancer and you have only months to live. You're never going to put a child in that position. And on that uh, on that subject, also in an academic situation, for example, school meeting, you want, if you have to say something about the child, you're not gonna say it in front of the child if it's a typical situation. So why you're gonna have a child translating his bad behavior? He's not gonna want to get in trouble with the parents. You know, you're not gonna put that child in that position or to be talking about stuff about one of their siblings, or he's gonna misinterpret because he doesn't want to get in trouble. So and again, most of the parents, when they move here, they don't know that there are laws, they don't know their rights. So they will say, okay, let's go ahead and let's do the translator with my child, but it's not okay. So please, if you're gonna take away something from this presentation, is never use children or youth as translators. Remember, I was talking before about the respeto, the respect matter, about the different words that we have to signal that respect, especially when you're working with elder people. They will expect you to refer to them if somebody's translating. Use the usted. That's the respectful term. They will be offended if you get on the first name basis with them. So usted is the word. But again, Spanish sometimes can get complicated and each country has their own thing. So sometimes usted and tú, depending on the country, are different. In Mexico, you use usted as the respect term. But in Peru, usted is like the one you use with your friends. So it always helps to know where your clients are from and be aware of these differences, because believe me, it makes a difference. Oh, they know. They respected me. They used the appropriate term. They get to know how to work with me, and they really appreciate that, especially with the eldest. And remember that here you're working with the whole family, and grandpa and grandma are the boss. what they say goes. So you have to get grandpa or grandma or both in your side. So this is very helpful to get that respect thing going on. And here, because I told you Spanish is complicated, and sometimes things get a little bit in some South American countries, instead of the usted and the tú, they got vos. And in some countries, there is a pattern of like the respectful term is vos, and in other ones is the common one for friends and stuff like that. So this is just a matter of reaching out to the providers and the people in your community and see where your Hispanic community is from and be aware of those little nuances in the language. Ways to reach and to encourage Hispanic families to get your services. Uh, the first thing will be de buenos días, buenas tardes, gracias, those little Spanish words. And try not to talk in a condescending tone, and try to, sometimes people, and this has happened to me before, sometimes people talk to me like I'm deaf, and they like trying to spread out the words, just be natural. The same way you were talking with another client with that same tone, same everything, you're going to talk with your Hispanic client. The only thing is that if you know how to say gracias or buenos dias, that will be nice. But if you cannot do it, that's fine too. They appreciate that you're trying to help. And be aware that there is a distrust in the system. Sometimes it's gonna take some time for them to trust you. So be open, be always very straight with facts, always explain to them how the service is going to be provided, what are the expectations, and be very clear with it. And if keep always be very honest. They are gonna smell if you're trying to sell something, or no, just be very honest and very natural. Don't treat them like they are different or just the way you treat any other of your clients. Try to connect with the leaders in your area that provide services for the Hispanic populations. Church is always a good resource. Nonprofits in the area, they will let you know which type of communities you have, who are the leaders, who are the go-to persons, and let them know what you have available. Keep work together. Sometimes they have like community events, show up, always be very personal, warm, and that will give you an insight of what are the communities that you have to serve, and those nuances, because it's not the same if you're working with Mexicans or you're working with people from Central America, or if your population is like from the South America, or if they are from the Caribbean. There are different nuances and things in the culture. If you're gonna make a brochure for an event and you put a Mexican flag, or you put, a piñata, and the population is from Puerto Rico, that's not gonna fly with them. So you have to be aware of who you have in the community. Materials in Spanish. Always get a good translator. For 10 years, well, it's been 14 years here in Michigan, and I see such weird translated documents. It is unbelievable some of the things I've seen, and they give that to clients. Again, they're respecting. They are not going to respect you if they see a very weird Spanish translation in their documents. So please make sure you have a professional doing it, and always have some native Spanish speaker check them out to make sure, sometimes there are things that get lost in translation. And always keep an open mind that, people are different, but we are always looking for the same things. We really care for our families, and we want what's best for them, even if we sometimes have different ways to see things. So just having an open mind, you don't have to have like a magic wand to understand Hispanics. Is common sense, and be respectful of the differences in the people you're working with. Another thing, mental health, like we talked earlier, it's kind of a taboo topic, and they don't, the counselor or the therapist is not the first go-to person for them. With anything that is going wrong, they go to their doctor, their general family doctor. That's the go-to person. So one thing to get to this population, one way is to uh, make a campaign of maybe doing some screening for mental health with your PCPs, with your pediatric clinics, with your family health centers. This is a way to reach to them. They will be at ease. There is no stigma because I'm just seeing the doctor. And always connect with the doctors and providers in those areas to watch for those things. If you see that somebody's having too much nervous breakdowns or anxiety and stuff, it will be their way of saying, I'm having issues, but I'm not gonna say out loud I might have a mental health issue, but I need help. I might need that referral to the mental health specialist. So I think this is one of the better ways to reach them regarding doctors and therapies and all that. Uh, and have the brochures, have the information in Spanish. They take a look at that. And that's always helpful because maybe that day they won't contact the specialist, but they have the brochure and then they will do the call. So always having Spanish materials in these offices, they are very helpful. Remember that what I say about they relax with time, with telehealth especially, you have to remind them that it's just 1 hour your appointment. If you arrive late, you're only going to have 45 minutes or 40 minutes or whatever's left of your appointment. And you have to remind them that they have to, if the appointment is at 9, it's not 9:15, it's 9. So always remind them that. And once you get to know them, they're gonna talk to you more and more and more. And we Hispanics like to talk. So when they get in a good relationship with you, I will suggest that instead of planning for 1 hour, plan for 2 hours with the client, because you're gonna get there. If they trust you, you're gonna get there. So yeah, be mindful of that. They ways to let the Hispanic community about all your programming or events you're doing go to Spanish speaking public radio, social media platforms. Hispanics like their social media. And it is my understanding that there is like some kind of business WhatsApp. So if you can get there, you're gonna get big with them. And again, Spanish materials in all the places so they will know what it's available. And always keep that communication with the community leaders. Let them know I have this event, my agency have this programming, and we work with this population. Sometimes they have events when they let the community know what's available, be aware of those. Those are a good opportunity to connect with them, meet with those church leaders. They have a lot of programming like childcare, like summer camps stuff, make them aware what you have available because most of the times they don't know. So this is a good way to connect with them. And always keep in touch with those people and see if for some reason you have a growth in the community, you might have to tweak your services. Keep always assessing those needs and connect your clients with the community resources. They are very community oriented. And especially when we are working in the line we are working, connecting people with mental health services, we want them to be part of the community. So if we are working with a Hispanic family, we want to connect them with what's available in the community for them. So it is very important to be aware of what's going on in our communities. Very important to remember about the Hispanic culture. Family is the most important thing for us. And we're going to do whatever is needed to make sure family are doing okay. So that's the strength that the Hispanic community has. We are going to do whatever is needed to help our family members. So involve them in the treatment, uh, make them aware of what is needed to do to help that person in the family. And they will gladly be a part of the treatment plan. And the father, don't keep him out of the picture. I know it's different for some other cultures, but having him involved in all these steps is gonna get you better outcomes. He's informed of everything that's going on because sometimes if you say to a Hispanic that we're gonna have a meeting and everybody's gonna talk about their feelings, he's not gonna roll with that. He's okay. I'm not gonna waste my time with this. But if you go and explain to him that having a family team meeting and all the roles that they can play in the treatment of that family member, then he will say, okay, let's be part of this and support our family member. So don't expect them to understand certain things like in our community, we don't do that much the therapy thing. Go and talk about our feelings or everything with somebody that is stranger. So involve him, make him aware that it's important that he's part of it, and give them options. Sometimes they don't want to. I know now with COVID, things are more complicated. Mostly what we are doing right now is telehealth. But in your regular way of doing things, sometimes even meeting in church or meeting in another space that is the home makes wonders. So it's just a matter of being flexible and, thinking sometimes out of the box. Again, the most important piece here is do not use children or teens as translators. It is very important. It causes a lot of trouble, especially for teenagers. that power shift is not good at all. And like we know, this pandemic is worsening the historical inequities in education, health, and it's affecting our Hispanic families real hard. And the adaptation and the acceptance only occurs when the family does not have to defend or justify their culture. This is very important. You know, we again with this is most of a common sense thing that some families do things different. Yeah, the clients don't have to be defending the way they do things. And the providers that are respectful and responsive to the beliefs, practices, our cultural and linguistic needs or our consumers have way better outcomes. I've seen it in my personal life that all those people that did that little extra make such a huge difference in the outcomes for my son and for my family. So I always tell that to the people I'm working with and supporting that keeping an open mind on our differences make wonders. And again, if you think everybody are looking for the same things. So, in this is my favorite quote about diversity. It is diversity is not about how we differ. Diversity is about embracing one another uniqueness. And it is so true. It is so true. It's one of my favorites. And yep, that's the end of my session. So now we're open for questions. So I'm gonna be checking the questions. My moderators are.
Hi, Francis. It's Tina. Thank you. Your presentation was wonderful. We have 3 questions. From Laura, she would like to know, how could we create healthy boundaries between parent youth without feeling like you are overstepping, not respecting one another in this culture?
Always, I will say, always explain clearly what are the purpose of if you're doing an assessment or the treatment or the boundaries, what is to be expected. Uh, Always be very respectful and sometimes give them time to process. You can explain to the person what you're gonna provide, and you can say, I'm gonna give you some time to think about it, to talk with your family about it, and then get back to me. That's what I will do to make sure I'm not overstepping or putting, too much difference, putting a wall between them and me. Be very clear and like give them some time to digest and make decisions.
Thank you, Francis. We have another question. What personal aspects of the people in this culture do you think impacts the numbers? Would seeking more help increase their resources?
Impact their numbers in
I will read it again. What
Okay.
personal aspects of the people in this culture do you think impacts the numbers? And would seeking more help increase the resources? Francis, if it's easier to read the question, it's in the chat
Yeah.
box. Just
Yeah,
letting
I
you
am.
know, it might be easy.
Yeah, I am reading it. Yeah.
Thank you.
Oh, I touched something here. Okay. Yes, I think that, yeah, reaching for more help, of course, I think it will increase their numbers. Yeah, I totally agree with that. The think about the strength of working with the family, reaching to the whole family as a unit, I think will get the numbers better.
Thank you, Francis. Our next question is, how can we hold the other providers responsible when they are not offering translation services to the families we serve? Those that continue to use or suggest these families do use minors during their services to translate. Would we proceed to report to officials? What is the best way to proceed with this situation?
I will say that there are laws and federal laws that protect those rights. There are different agencies that have like recipient rights offices. I will go and contact them and let them know these places are not complying. And another thing is that sometimes the family will prefer the family member translating, and you have to remind them that it's better to use the official translator because of it is the appropriate way to deal with that. But yeah, there are different agencies that have recipient rights offices, and in the presentation, the laws regarding the federal laws regarding this are there. So you can cite and quote, by this law, so and so, you're not complying. So make them aware they need to. So there is another question.
Nope, that's all the questions, Francis. Thank you. I just want to remind individuals to please complete the survey. I just put it in the chat box. There is a link, and thank you for joining us today, and have a wonderful day.
Well, thank you everybody for